So with that, I'm going to hand over the presentation to Michelle Lahuda, who's our Government Programs Director.
Thank you, Rick. Thank you for the introduction. And good morning, everyone. We appreciate you taking the time to spend some of your morning with us. As Rick said, I am Michelle Lahuda, the Government Programs Director here at Western Health Advantage. I am joined by my colleague, Denise Gruden. Denise is the Health Plan's Medicare Account Executive. Also joining us today is our Medicare consultant, Joe Flores from Flores & Associates. So in today's presentation, we will cover several items: who WHA is and why we matter to our community, a bit about our history and growth, what's new on the sales front, the strengths of our partners, our continued expansion of coverage and access, and how you as agents can share in our future. At Western Health, our mission is to expand access to health care and respond to the changing needs of our members, providers, and community to improve the health and well-being of all. We are a 501c4 tax-exempt, nonprofit public benefit corporation. We were created through a coalition of doctors, hospitals, and medical specialists here in Northern California. We're sponsored by Dignity Health Sacramento and North Bay Healthcare Solano out of Solano County. So how does this benefit our members? Under our HMO model of care, 92 cents of every dollar goes back to our providers. This allows maximum funding to be returned to those delivering the care, our providers, so at the health plan level, we can concentrate on patient care and member satisfaction. We are very community focused. We support the communities where we live and work, and as a local company, most of our economic impact is felt right here, from employing local people and supporting local businesses through our purchases to charitable giving and volunteerism. Charitable giving is encouraged at the employee level as well through paid time off for volunteering within the community and company matching for the organizations our employees support financially. We are a fully delegated, capitated HMO. So what that means is a health plan isn't an obstacle to the doctor-patient relationship. Our model lets doctors be doctors and focus on patient care. We do assume risk for prescription services and out-of-area claims. We believe in collaborating with our medical groups and hospitals. And approximately 260 of our Sacramento-based employees are here providing dedicated service to over 100,000 members. WHA is proud of its long-standing accreditation given by the National Committee for Quality Assurance, also known as NCQA. We provide health coverage to large and small employer groups, including CalPERS, the state's largest employer. WHA also participates in the individual marketplace, so individuals and families have the option of enrolling direct with Western Health or through Cover California. So here's a bit about our growth and our history. So back in 1997, our first members enrolled in the health plan in the greater Sacramento-Solano area. And in 2013, we grew the health plan into the counties of Marin, Napa, and Sonoma. And in 2014 is when we began our partnership with Cover California, the state-based exchange. And in 2018, we began being a plan option to CalPERS employees. So to share what's coming up for fall of 2020, I'd like to introduce Denise Gruden. And I'm pretty sure a lot of you know Denise from her work in the Medicare space with Blue Shield of California and most recently Premier Marketing. I'm very happy that Denise has made the decision to join the WHA family in the role of Medicare Account Executive. Before I turn it over to Denise, I have a couple friendly reminders. The first is that this information we're sharing with you today is considered proprietary and not for distribution. We are very happy to be sharing it with you all, though, however. And just a second reminder to make sure you take advantage of that Q&A box on the right-hand side of your screen. Denise?
Thank you very much for joining us. As Michelle mentioned, this is Denise Gruden. I joined Western Health Advantage as your Medicare Sales Executive, and I have been in the Medicare market for just about 17 years now. I'm so excited to be working with those of you that I've built relationships with over the years, and excited to meet those of you that I haven't yet had the opportunity. I'm very glad to be a part of Western Health family and to be able to present this wonderful opportunity to you. You know, we feel that you're going to be just as excited as we are. We're pleased to share that Western Health Advantage has submitted a bid to CMS as a new Medicare carrier entering into the Medicare Advantage market beginning January 2021. We're coming in with 2 highly competitive, benefit-rich MAPD plans, and beginning this October, you will have the opportunity to offer your Medicare-eligible clients a quality choice for their Medicare health plan. Now, as we're finalizing the full benefit plan structures that we will share with you in the coming months, please watch your emails and broker communication with dates and details on our benefit rollout and product certification meetings and seminars, webinars. Now, the Medicare market is growing every day, as you know. And with that growth in the Medicare eligible marketplace, it creates an opportunity. This opportunity calls for plans to come up with competitive choices for Medicare plan options. We feel that it's the right time, and Western Health Advantage is entering with a very competitive and quality choice for you to offer your Medicare beneficiary eligibles. Western Health Advantage is entering into 6 of the 9 counties that we currently serve. Those counties will include Sacramento, Yolo, Solano, Napa, Sonoma, and Marin. Now, both of the plans we're coming in with will be accepted by all of our medical group partners. Our medical group partners include Hills Physician, Dignity Health, Meritage, North Bay Healthcare, St. Joseph Health, and the Woodland Clinic. We have an abundance of network hospitals and medical centers. For those of you that are currently doing business with Western Health through commercial lines, our large network of hospitals and medical centers will be the same for our Medicare Advantage product. For those of you not familiar, please take a moment to review the list. Information on our medical centers and networks, as well as hospitals, is also available on our website. We have a very strong partnership with all of our medical groups, and with these respected medical groups and hospitals, we're confident that our relationships, along with the commitment to customer service, will be a welcome option for you to offer your Medicare eligibles. Western Health Advantage offers a user-friendly, comprehensive provider search tool. This allows members to customize their search for services and providers that fit their specific needs. Western Health Advantage offers a referral program, and this referral program is quite simply the Advantage Referral Program, and it provides members with access to specialists within their network, not just those within their assigned medical group. With a PCP referral, this program expands access to specialty care throughout our network. This is a very unique program to Western Health members. And those of you who have been doing Medicare for a while, I think you see the value in this type of option for somebody to be able to use a specialist throughout the network outside of their medical group is a tremendous benefit for your Medicare eligibles. We value our partnerships with our agents and brokers, and we want to provide you the opportunity to present quality choices for your Medicare eligible clients. So to get started, you need to be contracted and certified to offer Western Health Advantage. This will include your agent agreement, your AHIP certification, and your product certification. Now, Western Health is contracting agents direct to Western Health for Medicare. Our product certification and benefit rollout is planned for this August and September. So please watch for those notifications on the dates and times for training. I'd like to reiterate that Western Health Advantage is contracting agents direct for Medicare. And for those of you who are already contracted with Western Health, we're happy to provide you with an amendment. But for those of you new to Western Health, you can download the forms for the broker contracting at choosewad.com/MA broker kit. The packet includes an overview of Western Health Advantage and the requirements checklist. Now, as a resource to assist you with our AHIP certification, or with the AHIP certification, I would like to introduce our consultant to Western Health, Joe Flores of Flores and Associates. Joe's an industry veteran for over 26 years, and he's provided educational Medicare overview trainings for many agents. He's extended these optional training sessions to contracted Western Health Advantage agents in a 3-day boot camp to assist you in taking your AHIP exam. Training that's provided by our consultant is completely independent of Western Health Advantage training. And so now I'd like to introduce to you Joe Flores.
All right. Thank you very much, Denise. Good morning, everyone. Thanks for joining the call. My name is Joe Flores, and yeah, 26 years, entering the 26th year of the Medicare industry. Love what I do. I love helping the Medicare beneficiaries and also other insurance agents with Medicare. And every day there's something new, something developing, case studies. It's ever evolving, and there's a lot of questions and a lot of scenarios that come up. So it's my pleasure to help not only Western Health Advantage, but to offer my services to you. So the first topic I want to talk about is AHIP. AHIP is an acronym for the America's Health Insurance Plan. It's a certification program. It demonstrates that you have knowledge of Medicare, specifically Medicare Advantage, and all the components of Medicare and enrollment periods. The training for the AHIP is released on June 22nd. And I remember June 22nd because it's my birthday. It's my birthday present from the government, the AHIP package. So anyway, it's available on June 22nd. And the usual cost for AHIP every year is $175. But through Western Health Advantage and the relationship with AHIP, they're able to obtain a $50 discount to pass on to you. So please look out for emails or notification from Western Health Advantage on our link to AHIP so you can register starting next Monday. A little bit more about AHIP, the different components. There's 6 modules. Okay, so the first module talks about Medicare. So basically, the components of Medicare, A, B, C, D, what is hospital, what is medical, what is Medicare Advantage, prescription drug plan. The next component, Medicare options. You know, what is a Medicare Advantage plan? What is a Medicare supplement? What are HMOs, PPOs, private fee-for-service? So we talk about the different options available. Section 3, Part D, prescriptions. You know, we talk about how there's may or may not be a deductible, the coverage allowance, don't hold catastrophic coverage, how to avoid a penalty if you don't enroll in Part D, enrollment guidelines for Part D, so credible coverage. A lot of issues come up with a prescription, whether you have it part of a Medicare Advantage plan or as a standalone. So those are some prescription topics. Then we go into enrollment and marketing. Enrollment, if you don't like acronyms, sorry, not for you, because this is filled with acronyms. AEP, OEP, IEP, ICP. There's a stuff I can't even remember right now, but there are different acronyms for the enrollment periods, and they have different rules. So if you know the rules, you can help your client, and you can help them change plans and make sure that the client is happy with the coverage they're currently in. And then the marketing section, things you can say per Medicare, things you can't say, the difference between educational and sales meetings, and things you have to do to properly enroll someone onto a Medicare Advantage plan. There's another section on anti-fraud, waste, and abuse. Okay, so now those are the components of AHIP. I'll help you not only with test scenarios, but real world examples. And I'm actively selling the program, and I talk to agents every day. I answer questions, and there are case studies that come up. Okay, like yesterday, I had one person was asking, "How do I enroll if I'm moving? I'm leaving California. What do I do?" Another question just yesterday, I'm planning on retiring not until next year, but I turn 65 in July. What are my options? So these are kind of real world questions, not on the exam, but also so the program, I guess, is good for beginners that are brand new to the AHIP situation, but also for people that are experienced, because I'll help you with the review for AHIP, but also present real world examples, and it's a good refresher for everyone. The AHIP has a final exam. Okay, you need to have 90% passage rate to get your certificate, and you have 3 attempts. After the 3rd attempt of your final exam, unfortunately, if you haven't made it, you have to re-register and go through the modules again. But that's not going to happen, okay? Because we're going to help you. Please note the dates of the trainings: June 23rd, June 24th, June 25th. This is a Medicare overview, and 2 hours per day. There are 3 different sessions, okay? So part 1, part 2, and part 3. So please mark your calendars and join us, and it's worth your time. Okay, like I said, both for beginners and advanced agents with Medicare. Okay, so we talked about the dates, about discounts, and on the next slide, let's see here. What's in it for you? Okay, so besides the commission, which I'm going to talk about right now, there's a lot of value in presenting Medicare Advantage programs. I'll share a story with you. This week, I had a call from a person turning 65. Okay, and it was very rewarding because he said, "You helped my mom, and she's now 93, and we appreciate your services throughout the years, and now I'm getting ready for Medicare." So the mom's been with me for over 20 years. Okay, so I've helped her out, and so now every now and then I get the next generation, the son or daughter calling me. So I know I've done a good job throughout the years, and I've enjoyed renewal income because of that, and it's very rewarding. So as far as commissions, Medicare released their commission rates a couple weeks ago, and Western Health Advantage is paying full market value for Medicare Advantage enrollments. And basically, if the client or your Medicare beneficiary is brand new to Medicare Advantage, okay, so the initial year commission is $672 per application. Now, when I say initial, that means people that are new to Part B of Medicare. So they are turning 65, or maybe they're leaving an employer plan and now getting their Medicare A and B, or maybe they've had a Medicare supplement for years and now they're switching over to a Medicare Advantage plan. Those are examples of initial year commission. Okay, 672. Now, the renewal commission is cut in half. It's 336. So what happens that after the first year, if your member is with Western Health Advantage, they continue for the next year for the 13th month of enrollment, you start getting paid monthly. So 336 divided by 12, it's a monthly payment for the life of the policy. So as long as they're on the program. Now, renewal year is also paid for people that are leaving a former Medicare Advantage plan. So a competitor that has Medicare Advantage, they hear about Western Health Advantage, you enroll them on Medicare Advantage, but they've already had a Medicare Advantage plan, so you get the lower commission of 336, again, divided by 12, so it's a monthly payment. Okay, so what's in it for you? It's a great living. You're helping people, you're getting paid, and the opportunity is very exciting. As Michelle was talking about earlier, the strength of the company. These webinars we've been having are highly attended. There's a lot of excitement. Western Health Advantage, strong company, great, excellent reputation. People know Western Health Advantage, nonprofit, community focused, based here in Sacramento. And they have some major contracts, like, for example, the PERS contracts for public retirees, and also Cover California. They're part of Cover California, and they have achieved NCQA accreditation. So the strength of the company is there. So you'll be proud to represent Western Health Advantage. And then Denise mentioned some other things about the Medicare growth overall in the market. Great opportunity, baby boomers, the market expansions. And by the way, these expansions don't happen every year. So Western Health Advantage is going to 6 different counties, large service area, strong benefit package. We can't talk about the details today of our benefit package. It's under CMS review, the Centers for Medicare and Medicaid Services review. But we are excited to present a strong package to all these areas. And one of the strengths, another strength, is the relationship we have. Western Health has a relationship with the providers. Okay, so part owners and long-term contracts. So we're looking forward to a strong marketing campaign with our providers and partnership with our providers. Plus, there's a Vantage referral program, and we could talk more about that through product certification regarding referrals within each contracted medical group. It's unique to Western Health Advantage. So just as a reminder, please go on to the website and download your agent agreement and look at the AHIP link that's coming soon and register for the Medicare overview sessions, and then look out for product certification. Probably in August, the way things are shaping up, by the time Medicare reviews, we'll have dates for you in August for certification. So you have your AHIP, and then you have to go through a certification program with Western Health Advantage.